valves located in the chest, directly above the diaphragm in the region of the thorax called mediastinum, specifically the middle mediastinum. The normal human heart varies with height and weight. The tip apex of the heart is pointed forward, downward, and toward the left. The inferior diaphragmatic surface lies directly on the diaphragm. The heart lies in a double-walled fibrous sac called the pericardial sac, which is divided into a fibrous pericardium and B. serous pericardium. The fibrous pericardium envelops the heart and attaches onto the great vessels. The serous pericardium is a closed sac consisting of two layers, a visceral layer or epicardium forming the outer lining of the great vessels and the heart, and a parietal layer forming an inner lining of the fibrous pericardium. The two layers of the serous pericardium contain the pericardial fluid, which prevents friction between the heart and the pericardium. Normal human heart varies with height and weight. Weighs approximately 300 to 350 grams in males. Weighs approximately 250 to 300 grams in females. Right ventricle thickness is 0.3 to 0.5 centimeters. Left ventricle thickness is 1.3 to 1.5 centimeters. Divided into four distinct chambers, composed of three layers: epicardium, myocardium, and endocardium. Contains two atria, left and right. Contains two ventricles, left and right. Contains four valves: aortic, mitral, tricuspid, pulmonary. The wall of the heart is composed of three layers: A. epicardium, B. myocardium, and C. endocardium. The epicardium is the outer lining of the cardiac chambers and is formed by the visceral layer of the serous pericardium. The myocardium is the intermediate layer of the heart and is composed of three discernible layers of muscle that are seen predominantly in the left ventricle and interventricular septum alone, and includes a subepicardial layer, a middle concentric layer, and a subendocardial layer. The rest of the heart is composed mainly of the subepicardial and subendocardial layers. The myocardium also contains important structures such as excitable nodal tissue and the conducting system. The endocardium, the innermost layer of the heart, is formed of the endothelium and subendothelial connective tissue. Chamber and valves. The heart is divided into four distinct chambers with muscular walls of different thickness. The left atrium, LA, and right atrium, RA, are small, thin-walled chambers located just above the left ventricle, LV, and right ventricle, RV, respectively. The ventricles are larger, thick-walled chambers that perform most of the work. The atria receive blood from the venous system and lungs and then contract and eject the blood into the ventricles. The ventricles then pump the blood throughout the body or into the lungs. The heart contains four valves, and the fibrous skeleton of the heart contains the annuli of the four valves: membranous, septum, aortic intervalvular, right and left fibrous trigons. The right trigon and the membranous septum together form the central fibrous body, which is penetrated by the bundle of His. The fibrous skeleton functions not only to provide an electrophysiological dissociation of atria and the ventricles, but also provides structural support to the heart. Each of the four valves has a distinctive physiological stability.